Hello again. I have a extension. We're going to get started with our program.
Hello.
Yes, hello, this is Susan.
Hello.
And I'm so glad we had such a turnout tonight, or this afternoon, because wow, yeah, this room is full. And I figured most of you are probably pretty full by now too, because there was a lot of food in that tray. That was from Critchfield. And we're hoping to be able to use them again in the future because we really like what they have to offer us. All right. So I just wanted to announce that there is going to be a meeting about transportation. And it's going to be a meeting that's virtual, so that you will need to be able to access it with your computer or smartphone. I believe it's going to be on May the 9th. But the information will be in the newsletter that comes out May 1st. And you do have to register for this in advance, and you can register online. So be looking for the newsletter. If you're not signed up for the newsletter yet and you want to participate in this transportation meeting, they're looking for input. Just give us a call and we'll give you the website where you need to register. Also, there's going to be a wood burning workshop in June. Wood turning, sorry. I guess I'm not going. I'm not really a crafty when it comes to that, but that'll be on June the 2nd. So if anybody here would like to learn to make items out of wood. You can make pens and you can make bowls and all kinds of wonderful things. So that's going to be in June, and the information on that should be in the newsletter also. I did say wood burning because my brothers used to do wood burning, and can't read by writing. Yes, well, the wood turning is for the visually impaired. They're going to be making it suitable so that. And where's it going to be, Theresa? Are you here?
I am. Louisville. It's a symposium where we're just going as guests, and they're going to donate a lathe to us and teach us to be able to offer classes. So if you're interested, you have to let me know today. I have to turn in the names for insurance purposes. So, but if you're interested but don't want to go to Louisville, it's an all-day thing in Louisville on June 2nd. We will be bringing it back and teaching it here.
Okay, and I did want to invite anybody who doesn't know about our SAFE group. We have a virtual meeting on the first Thursday evening of the month for spouses, for family members, for friends, for caregivers, anybody who is interested in assisting and learning more about ways to assist a visually impaired or blind person. And it is it is for you. We meet for about an hour. And so just so you know about that, please ask me about that if you are interested in getting on that list. We have small group meetings. I know this large group can be a little overwhelming at times, but we have small groups where we sit around and talk about our challenges for those who are visually impaired and blind, or however you want to identify yourself there. Low vision, visually impaired, blind. So, okay. So just so you know about that, we also have an assistive technology program where you can meet with Sam and learn, or Richard, and learn about different devices and magnification and talking devices that will help you accomplish tasks that you might have thought you couldn't do anymore. So that's pretty exciting that we have that going on. We have a whole lab set up for that. Because I know we have some new people here today, and I just want to hope everybody feels welcome. to our first lunch and learn in our new location.
Hey.
I'm going to now introduce our speaker for today. This is Hazel Teichen, and she works with PACE, P-A-C-E. And she'll tell you what that stands for. But it is a program that will help people stay in their own home rather than possibly going to a nursing home. And it's like assisted living in your own home. So it's pretty cool. And she'll tell you about the qualifications for that. Maybe it'll be something that you might be considering for yourself or for a loved one. Okay, here's Hazel.
Thank you, Susan. I'm very glad to be here today. Theresa, I see you in the audience. Nice to meet you.
Thank you.
So I'm really feel very honored to be here today to talk to you about this new program. It's just okay. Okay. Oh, all right. Okay. All right. Okay, you can hear me now. So, again, my name is Hazel. I'll give you just a little bit of background about myself. I'm actually from Chicago. Came to Kentucky about 8 years ago. I worked for a hospice and home health provider in Chicago for 8 years and came down here and was fortunate to get a job with Bluegrass, at that time hospice with Bluegrass, now Bluegrass Care Navigators. And about this time last year, I was able to interview and get the job as the outreach coordinator for the PACE program. So I'm very excited to share with you today. So what is PACE? PACE stands for Program for All-Inclusive Care of the Elderly. It was a program that started actually in the 70s in San Francisco. There was a community of people who were really struggling to pull together resources to help support their loved ones so that they could stay in their own home and be independent. In the 90s, it became a Medicare and Medicaid program. So we are under the Medicare and Medicaid umbrella. That is how we are paid for what we do. And Bluegrass Care Navigators PACE program, we were the first to bring it to Kentucky. We opened our doors last year on July 1st. So while it is across the country, there are lots of states that still do not have PACE. From what I understand, the state of Kentucky had been trying to bring it here for about 20 years. And Bluegrass Care Navigators have been working for 5 years to get to July 1st last year. It's because it's under the Medicare Medicaid umbrella, it's very heavily regulated. So there were a lot of compliance issues and things that we had to get in place to be able to become a PACE provider. So PACE is a unique model of managed care for the frail elderly, most of whom are duly eligible for Medicare and Medicaid, and all of whom are assessed as being eligible for nursing home placement of care according to Medicaid standards in Kentucky. So our goal is to keep you out of a nursing home, but to come under PACE, part of the eligibility is you have to be needing some help. The same kinds of things that would qualify you to go into a nursing home. So while that sounds like a big thing, it's really a small thing. You might need help with bathing and dressing. You might need help with ambulating and eating. It's just a minimum of 2 things, activities of daily living, that you need help with to meet that regulation with the state of Kentucky. So PACE is both a model of healthcare delivery for a very specific population and an insurance product. So while the message of PACE starts out really big, it narrows down as we get to the population that we're able to serve. And I'll get to the eligibility in a little bit. Bluegrass Care Navigators PACE program becomes your insurance provider. So you actually get issued an insurance card, and we coordinate all the care you need medically in the community to make sure that you're getting your needs addressed, but we're actually going to be the one that pays that bill. So we cover all of your medical needs, just like a Medicare and Medicaid would as an insurance provider. At the core of the model is the belief that it's better for the well-being of seniors with chronic care needs and their families to be served in the community whenever possible. And certainly we all know 99% of people would like to be in their own home if possible. And that's really the mission and goal of PACE. So for someone to become enrollee in PACE, they need to forego their usual sources of care, and they're going to receive all their medical care through the PACE organization. So as you can imagine, it's very heavily focused on care coordination. And again, as I mentioned at the beginning, it started because they were struggling to pull resources together. In PACE, that's what we've done. We've got all the resources pulled together. Our PACE medical director becomes your primary care physician. So that is one thing you have to do if you are eligible and you want to come to PACE. You give up your primary care physician and come under our medical director. Now, having said that, some people use the ER for their primary care physician. They don't even have one. Or they're not really utilizing their primary care physician the way that we can benefit them with PACE. So I said that we're both providers and payers of the healthcare services. PACE has to include anything that Medicare and Medicaid would cover for you. So whatever you might be able to get through them, we have to be sure to provide. It's pretty amazing. So far, we've been open since July. As of today, we have 21 participants. We do call them participants, not patients. We've had 300 referrals to get to those 21 people that met that eligibility. So as I said before, it starts out as a big program, a big message, but it narrows down when you kind of get into the exact details. So we have to include for those individuals anything that they might get covered with Medicare and Medicaid. So far, we have done, everything from dentistry to hearing aids. We put a ramp on a house. We provide medical equipment. So all kinds of things can come alongside to make sure that that person's able to live independently and stay safe. So we assume the full financial risk without any limit of duration or scope of services. So we anticipate we will have some people with us for up to 15 years, all the way maybe to end of life. We also don't discriminate because someone might be too medically complex. So we can't really cherry pick people based on, that person might be costly because they've got a lot of need. Nope, if they meet eligibility and want to enroll, we enroll them in PACE. So the services that are available through PACE, certainly preventative care, because we're going to pay for all of the care. We're going to really strive to get good preventative care. We're going to support the chronic disease symptoms that individuals may have. We are going to provide activities of daily living, including bathing, dressing, feeding. We can help with that. We do have mobile dentistry that comes once a month. Many of our PACE participants have not had dental attention in years or maybe ever. So we've been able to really we know that good dental health is so important for good nutrition and being able to eat and care for yourself and heal, or stay healthy. So we do have mobile dentistry that comes. We've contracted with optometrists and audiologists. We do coordinate those appointments. We provide the prescription drugs and all the medication management around that. And, the medical world has kind of sliced and diced us into little silos. You have a cardiologist, you have maybe a neurologist, you have a primary care, and everybody's kind of in your stuff, but nobody's looking at it kind of big picture. So we know that medication management and that prescription, getting things right and making sure we're looking over that is really an important thing for individuals, because medications can really be something that can turn life upside down and can really put people at risk. We also have contracts with UK and Baptist for emergency care and support management. So let's say that an individual who's living at home fell, broke their hip, called 911, went to the ER in UK, went in for surgery, then they went to a facility like Lexington Country Place for rehab, and then they went back home. Bluegrass PACE Care has paid for every step of that journey.
That's great.
So and now our goal is to keep people from having incidents, but we are fully responsible for whatever their needs are all along the way. So if you're not scratching your head by this time saying, wow, how can that be? It's pretty amazing. Transportation, you were just talking about that, Susan. That's another huge barrier for individuals to stay healthy, to maybe get to their medical appointments. So we provide transportation to and from doctor visits and to and from the PACE Center. So the PACE Center is a beautiful building that is just, we could walk there from here. It's located down by Sullivan University on Members Way, just off of Harrisburg Road. It was our hospice clinical office. And when we moved our headquarters, we moved all our buildings, 3 buildings into one, just down the street this way. It gave us a perfect template to build out a PACE Center. So what is a PACE Center? Well, it's got, it's a beautiful space that has a large and small activity room. We have a computer space. We have 3 beautiful roll-in shower rooms. I had no idea until I started working with PACE how difficult it is for individuals to have a safe shower. A lot of people that live in certain situations, maybe in a communal shower situation, and they can't have a shower chair because someone would steal it, things like that. So we're able to help. They can come to the PACE Center and get a shower. We have a beautiful commercial grade kitchen. Depending on what time of day you come, you can get breakfast, lunch, and a snack. We're open from 8:30 to 4:30, 5 days a week. And some people come 4 days a week. Some people come maybe 3 hours a day, twice a week. It just depends on what the individual's need is. We also have a beautiful therapy gym that has all the bangs and whistles. Our therapy program is a little different than a home health, where there's a limited number of episodes you can have with therapy. Ours is unlimited. So people can get good oversight and help with their therapy. We also have a registered dietitian who does all the meal planning, prepares those meals and lays out our monthly meals and snacks. We can provide meals in the home through Mom's Meals. We do have an individual who is bedbound, so she can't come to the PACE Center, but anything we would provide there, we have to provide at her house. So we actually go and help her with bathing. We do provide meals for her. Therapy goes and works with her. So it's pretty amazing. And think of the PACE Center as kind of an adult daycare center with a beautiful 5 exam room clinic attached. So when you come, not only can you have activities, we have a recreational activity member who does all of the activities. We have a beautiful outdoor patio that was added. It's all safe and secure, so people can get out in the sunshine a little bit. So it's, and then we've got this clinic where you can get all of your medical needs, that anything you get from a normal primary care, whether, and we can do lab work there, and we can get people to appointments to get an MRI or get them to where they need to go for an eye exam or whatever it is. And we provide all the transportation to and from. We are responsible, however, for our participants 24/7, 365. So if they have an issue on a Saturday night at 2 a.m, they could call the Bluegrass intake, our support center, and get a message to our PACE team of what their needs might be, and we can address those needs. So they're under our care, whether they are in the center or not, or whether they come to the center or choose not to. Any questions so far? Yes.
I've got 3. They're 2 are kind of specific.
Okay.
But one is you're talking about all the care for someone. What if it's very specialized, like for macular degeneration? You go and you get the injections in the eye. You guys provide that, or how's that?
We would provide those appointments, transportation to those, and we schedule those appointments
Because
because,
you still have the same provider. For
right, you would, because we have to, that provider needs to know that you are a PACE participant and we are paying that bill.
Okay.
So we work that out and we schedule the transportation and the appointments. Yes.
Okay, great. Second one, you were talking about anything Medicare, Medicaid would pay for. Implants, like dental implants. I know you have dental.
Mhm.
Would they cover, if this person has help with coverage, their dental insurance covers most of it, maybe not all of it? You guys cover implants, sort of like 1, 2, or certain amounts, or?
I would say, so far I know we've done dentures and extractions and we've done cleanings. Now, some of that's going to be determined based on whether or not we think it is the right thing to do. And then, yes, we would. Keep in mind, you're going to be under our insurance.
Right.
So you're not going to have dental insurance somewhere
Right.
else. You're going to be with us. But yeah, so far we've done just about anything anybody has needed, we've done.
You'll
So,
probably get to what the area is that you cover.
yeah,
so-
the areas, and then we get into the insurance, which is where it really gets tight.
Okay.
But thank you for the questions. Anybody else? Yeah.
Do you have restrictions on cognitive abilities
No.
of your patients?
No, good question. Dementia or even mental illness is not a barrier to PACE. Neither is HIV/AIDS. There really isn't anything that is a barrier that way. And a lot of those people face a lot of barriers to getting good care because they are somewhat marginalized sometimes. But no, we have, in fact, nationally across the country, with the 60,000 PACE participants that are in PACE programs, 46% of those have some sort of dementia. So, and most of them have up to 5 kinds of chronic disease they're working with. So we're able to help people that really have multiple things going on. There really isn't a limit to what we can do. So we talked about the transportation, the recreational and occupational therapy, the nutritional support by our dietitian, who's wonderful. Let's see. Got that, we got the showers down, you can bring your laundry and we'll do your laundry. We have a beauty shop. Let's see what else. It's really quite amazing.
So haircuts would be covered.
Yes, yes. I don't think Medicare pays for your laundry, but we do. We do your laundry for you. And then those wheelchair accessible shower rooms are really, really wonderful. And then our staff offices are there. So the eligibility to enroll in the PACE, yes,
Do you have a microphone?
yes, am I not talking enough for you, loud enough?
No.
Okay, I'll try to stay behind it. I tend to get moving around. Okay. So the eligibility for the PACE program, you have to be 55 years or older. You have to live in the service area of the PACE organization. And again, this criteria is Medicare and Medicaid PACE criteria, not Bluegrass. You know, we follow their lead. You have to live in the service area. So for us, that includes Fayette, Anderson, Woodford, Jessamine, and Franklin counties. And we do have participants that come to the center and we provide the transportation from all of those counties. You have to be certified by the state in which you live to need that nursing home level of care. And again, that's those two indicators that you would be able to get into a nursing home. And you have to be living safely in the community at the time of enrollment in PACE. We can't help individuals who are homeless. We also can't, and this is a tough one, but we can't help veterans if they're accessing their veteran benefits. But we can help them if they're not. And that is all there is to the, it's 55 or older, live in the service area, meet that nursing home level of care, and be living safely in your home at the time of enrollment. So let's talk about insurance just a little bit. To be able to meet the eligibility beyond that criteria is that you have to be Medicare and Medicaid or Medicaid only. And if you are, the services are 100% covered. You don't pay a dime. Now, what we have found with the 300 referrals we've gotten to just get down to 21 people, a lot of people have an Advantage plan in their Medicare. If you can afford a Medicare Advantage plan, you have access to resources. PACE is trying to help individuals that really have limited to no resources or no one to help them. They may live alone and have no family, no caretaker, but you do have to have sort of traditional Medicare and Medicaid or Medicaid only. And that's where it tightens up pretty quick. If you have Medicare only, you can pay a monthly fee, but it's $4,800 to $5,500 a month. So needless to say, only 1% of PACE participants in that 60,000 pay that. It's not a program designed for people that have lots of financial resources and other kinds of things. It's really for individuals that are struggling to stay independent and have a lot of needs, but not a lot of resources. So the value of PACE for Kentucky, certainly it improves patient care. There's an emphasis on preventative care over institutional care. We know it's costly to put people into a nursing home. It's less costly for Medicaid coverage because the rates are capped, and it's budget predictable. So Bluegrass Care PACE or Bluegrass Care Navigators PACE program, Medicare and Medicaid pay us X amount of dollars per participant per month. And we have to make those dollars cover everything we're going to do for that individual. It's a huge financial commitment to take on this PACE model of care for us, but we know that it's really needed in the state of Kentucky. Other PACE providers are looking at opening other PACE centers across the state. That's really good news. So for the state of Kentucky, it's a really great plus to their budget because now they know exactly how much they're going to spend on an individual who prior to this might have been going to ER for their primary care, might have been having episode after episode of things really failing, high cost. They're using the hospital way more than they really would need to, things like that. So they know exactly how many dollars they're going to spend. And so for Kentucky, it's great. And for the individual, or let's see, for the healthcare delivery system, It shifts that financial risk that the state had to us, and now we're responsible. It reduces those unnecessary, unwanted, and potentially harmful forms of healthcare utilization. So we're going to try and kind of disrupt that pattern of using the ER for every care need we have. And it addresses health equity, and that's what I'm most proud of. This is a program that really is to help those that are underserved. I'm certain there might be people in the room that really could benefit from PACE and meet the eligibility and criteria. So it's a great program to help those that have kind of been off the radar or slipped through cracks or don't have a way to even know where to begin to get some quality health care. I did give you a flyer that it's just a 2-page sheet that I kind of blew it up as big as I could get it. If you had thought you had someone that you would like to find out either more about PACE, or you think you might have someone that could benefit from PACE, making a referral is very easy. It does not require a physician's order. All you have to do is call Sandy Gowdy. She is our intake specialist, and I put her number there, and I have cards out on the table, and she will take it from there. All we need to know is, do we have permission to call whoever it is you're referring? And we need a contact number. And then she will meet with them, introduce the program. It's a very soft introduction. She doesn't come in and bulldoze over. She really gets to know people and understand their needs. And then we take it from there to see if we can get them enrolled. One thing I'm also very proud of, I'm going to show this little prop. This is our enrollment book in Braille. So pretty nice. I don't know what it means, but somebody in this room most likely could read this cover to cover. But I think that's pretty neat that we've already prepared ourselves. We do have a participant who is legally blind since the age of 10. And she comes 5 days a week and adds a lot of interest to the group. She's delightful and we're really happy to have her. So there aren't any limitations. Yes.
Can you tell us about any of your recreational activities? What do they do?
Sure. So we do everything from bowling. We have, big pin bowling. We do, of course, bingo, which is, favorite. We do crafts, painting crafts, construction type crafts. We do trivia games, different things like that. Lots of engagement. It's a variety of people. It's never the same one day to the next because different people are there, depending on the day, and different, there's different skill sets or levels of whatever anybody could do, but we really address that one-on-one. We make sure that we're getting, because that's what we want. We want people to come to this bright, beautiful place and engage and get some socialization. Yes, sir.
Is that a nursing home or a daycare center?
It's a daycare center.
What's the name of it?
It's called PACE Care. It's the
PACE.
Bluegrass PACE, Program for All-Inclusive Care of the Elderly. And it's just down the road. We provide the transportation. When you come, you get to meet the other friends that are there. We have big recliners for naps. We have TVs, to watch your favorite TV. There's some quiet rooms where you can go and kind of be by yourself if you want to just be quiet. So lots of good things going on at PACE Center. Yes.
Is that center on Midland Road?
No, it is it's right down the street here on Harrodsburg Road.
I have a question.
Okay, go ahead.
Now, the only people though that can go to this center are people who qualify for the program.
Correct. Yes,
So it's not anyone who wants to go there. It's
correct.
people who qualify and have to be nursing home eligible.
Right. And again, that nursing home eligibility is not a big lift. That is not the biggest barrier. The biggest barrier is insurance. So many people have some kind of advantage plan, or they've, had insurance companies hounding them, giving them $150 a month for groceries and different things like that, which is great. But we can go way beyond any insurance provider. That's what we can provide.
Do you provide any, like the food cards and things like that, the nutrition and
Well,
other than your
we provide meals, and then if we need to get somebody like with a SNAP program or something, we can help navigate that. We can help them apply for Medicaid. We can help with advanced directives. with, help with a phone, things like that. So yeah, we have a social worker on our staff, and that's what she's all about, is all those resources. Yes.
Do your, people that help run your facility, do those people that come, do they do IP, individualized program, like chart, like, what they need help with to find out, like, where they might want to make their goals better?
Oh, sure, absolutely.
Okay.
We put a care plan together.
That's
at the
what
very
I was
beginning.
wondering.
Yes, we do. Sarah?
The service area again is Fayette, Anderson, Woodford, and what other counties?
Jeff, Franklin and Jessamine.
Franklin and Judgment. They must live alone.
No, we have a woman who lives with her daughter, but she's Medicaid, the individual's Medicaid with dementia, and she comes 5 days a week.
Okay.
They don't have to
So
live
they
alone.
don't have to live alone, but they cannot have a secondary to Medicare either.
Correct.
Okay, thank you.
What
Yes,
if the housing situation changes? They're affording their house at this point, but what if they can't in the future? Is that comes up or?
well, usually if they can afford their house and they're not eligible for the Medicaid part of it, then they're not gonna get into PACE, but if they do a spend down or something like that, then they could. If they move out of the PACE service area, unless there's a PACE provider where they're going, they'll disenroll from PACE. They also can disenroll by choice if they find out that it's not what they thought, or, something's changed and they don't want to be in PACE. They disenroll and then it'll go back to whatever their insurance was prior on the first of that next month. And we enroll, people start the program on the first of the month, but we got to get all the stuff started at the beginning of that month. Right now, we've got 3 people coming for May, but we're talking to people, but no one else will be able to get enrolled by May 1st. It takes several weeks to process everything. Then it gets packaged up and sent to Kentucky to get the blessing. And so far, everyone we've sent has gotten approved. So that's really good. Did you have a question?
Yes, so with the PACE program, and you are qualified for it, does that mean like a caregiver will come in the home and assist the person, or do you have to be able-bodied to go to the adult center?
You don't have to come to the center. We're not going to provide like 24-hour caregiving, but we might do some supplemental caregiving.
Like active?
The activity person comes, if you're homebound, then they'll come to the home. We have a gentleman that we're signing up for May 1st, and he does not want to come to the center. So whatever we provide there, we have to provide at home, based on if that's what he wants. But yeah,
But do they get like a caregiver?
well, they can get a caregiver for, depending on the need for a period of time.
Not like, I guess what I'm trying to say is, if the individual stays at home, do they get help there?
They'll
So
get
they
our,
might get a bad for the meal.
yes, sure, or the physical therapy, or our social work comes and visits, things like that, but it's not like having an aide with you. We'll do some light housekeeping, we have someone we help with organizing their home, they live in a very small apartment here in Lexington. And one of our aides goes over a couple hours once a week and helps him organize his things. So it's kind of person by person, but I don't want to mislead you to think someone's going to get 8 hours of an aide in the home.
So it's basically an insurance case, is insurance.
Yeah, PACE is an insurance, yes, it's
Okay.
an insurance provider, but pretty robust. I mean, we don't have the limitations that some of those Medicare programs have. We've got a lot of latitude.
It's nice.
And we can get the DME, we can get, Depends and incontinence supplies, we can eyeglasses. We've got a couple people that are getting their eye exams, and we have a gentleman who started with us when we discovered he has cancer. We're now doing all of his chemotherapy and guiding him with that, and so it's pretty amazing. Yeah, Theresa.
And the meals, if they don't want to go to PACE or they just want to go a couple of days a week, they can have those home delivered, even if
Yes.
they're not homebound?
Yes,
Okay.
yes. And it's mom's meals. I don't know if anyone's familiar with them. But they're
Um,
fresh meals that are made, and I think they get, depending on what their need is, they get X numbers of meals delivered that they can, they're all prepared, you just have to.
so if you don't mind.
Yeah. Christine.
Do do they have them in, do they have it in different states?
Yes, there's quite a few states that have it, heavily on the East Coast and West Coast.
Is Texas one of them? Like
I
Houston,
don't know right off the top of my head.
because I will never, I've been through the nursing home with different family members, my mom's second marriage, and I will not put any of my possessions on.
Right,
I would rather, have them, like you're saying,
yes,
stay at home,
yes.
go to the center, they're homebound, and if you have to care and have that, you know,
Yeah,
what's your problem?
yeah,
And
I'll have to look, yeah,
I was thinking,
yeah, yes.
I just remembered.
Participants,
Yes.
right now, Bluegrass Pace Care has 21, with 3 more coming in May. And we've been open since July 1st. But think of it, this is a brand new message.
Sure.
New to Kentucky, people don't, it's a lot to get out there.
How big is the national?
There are 60,000 people, there's 147 providers of PACE.
Do you see your provider network on your website or anything?
Our nurse, our physician,
Yeah, well, if you, like, a lot of people here are
Right.
They would want to make sure that they're.
oh yeah, that's how that works. We coordinate with your outside providers. Anything that we can't provide through primary care that you're doing, dialysis, eye appointments, all those things, we coordinate that. and get that to you.
That's for services contract. As far as you're concerned.
Yeah, because we're gonna pay for it. Yeah, so it's everybody that, yeah, Christine.
Are you still, even though you are still able to keep your doctor,
You keep
your
your,
same doctor?
you keep your outside physicians, not your primary care. And that's hard for some people. There's been a few people that won't give up their primary care, and we understand that. But we have to be, we're gonna be managing all that care, and it has to be coordinated through our primary care physicians. Dr. Bob. Theresa,
Do you provide the transportation to dialysis?
yes. Yes. Any of those outside appointments. And this transportation is, medical vans that are scheduled and timely.
That's why I asked,
Yes, this isn't wheels, this is your own ride.
which is wonderful, especially after dialysis. I
Yes.
know a lot of people that
Didn't
really
wait,
bad
got tired.
experience after dialysis with wheels,
Right.
so that's a nice plus.
Yes. Yeah.
What about home dialysis? Would you come to the house at night?
You got me on that one. I don't know. Someone who's homebound?
Not necessarily homebound, but for the home dialysis.
Okay.
To be hooked up at night. You know.
I you got me on that. I'm not sure. I wouldn't want to- Yeah, it's kind of case by case. I'm not sure. I do know we have someone who's using a feeding tube and we have to do things related to that. Yes.
One of the other things that would probably disqualify, and she's asking about care in the home, would be someone that needs 24-hour
Right,
care.
right.
Be nurse.
Right,
Okay.
exactly. That's pretty much how, in fact, we have one participant that's in a nursing home right now because she was starting to decline. Her goal is to get back home and we're gonna get her there.
Oh,
But she's in Frankfurt, we contracted with Frankfurt Care and Rehab. We are still responsible. We're paying for it. We go and visit her. We
she
go,
was at home first.
she's at home first. So she's been with us for several months, but started to take a decline. So we put her in there because we couldn't provide that 24-hour and she wasn't safe.
So basically, if someone's currently in a nursing home, they would qualify.
Correct.
Okay.
But if someone's in a nursing home discharging, that's gone through a rehab or something like that, they could,
Or if they have a place to go home too.
right.
What is your max people that you can take care of?
We don't have a max. Some states do put a limit on PACE. When we did our initial drill down to see what we thought we would have, 300 is what we're thinking.
And how many employees? Are there doctors at the PACE location?
There's a primary care physician, a nurse practitioner, 2 nurses, well, more than that, because one is a home care coordinator, she's a nurse. The executive director is a nurse. And then we have a transportation person, our dietitian, our rec therapy, our physical, and occupational therapy. And then Sandy and I are the others. So there's about 16 of us, I think.
So those people will kind of like be like your medical doctor.
Correct.
And either take care of you right there or send you off like my doctor does to this doctor, that doctor, that
If,
doctor.
if you need that, yeah,
You
right.
just like are taking care of. For older people like me, I would go to my annual physical and then tell her what is going on. And she'll set up those appointments, or I will go home, or he will, because he goes to a different doctor. And then he has to make those appointments. That is what you guys are gonna do.
We do, we
for
make
the
all those
people.
appointments.
And
Because-
get people there.
Yes. We have to schedule
Their
the
medicine.
transportation and,
And-
yes, and we also do, yeah, medication is included. I mean, it's 100%.
Yeah, and then like me, today I went and picked up my medicine and I messed it all up, taking it incorrectly.
Yes,
He said, there's this thing that I can put an application in and order it for you, and you put your bottle down on it, you'll do that kind of thing too. That's the advance that you're talking about.
right, right.
That I have, that I wouldn't be able to get because I have that, so I would be disqualified. To say,
We're not
the
just,
advance.
no, you're not disqualified. It really gets down to your Medicare. That's where, but as far as what comes alongside, if you're eligible, I don't know what we're gonna say no to.
Yeah.
But we do meet and talk about it as a team, you know, so.
You would be, in other words, someone like a child, you know, like my kid might have to take over.
Right, it's
My
case
medical
management.
needs.
Yeah, it's case
Yeah.
management. You know, we're really getting all those eyes on the situation and working together to make sure everything is addressed. Absolutely. Yeah. Pretty phenomenal. I wish it was a little broader for me getting in, but I don't, you know, I don't run Medicare and Medicaid, so, but
So what's the benefit of you guys? What keeps you guys going?
what do you mean?
Like, how do you keep your doors open?
Well, to be perfectly honest, it's because we have a very solid financial footing with Bluegrass Care Navigators, the hospice, palliative care, and all the programming we run. That's why I think, you know, it might be harder for some other people to consider opening PACE because you basically got to carry yourself, all of this, for a period of time until you get enough participants that it starts to flow better or whatever. Our motivation is our CEO came from Florida 6 or 7 years ago, and she had a PACE program attached to their hospice down there. And so for Liz Fowler, this has been like a dream of hers to bring us to Kentucky. So we're able to support it because and we, you know, we've broadened what we do the hospice and palliative care, but we've broadened that to try and be sure we're addressing people with earlier up the care continuum, with more services earlier on, so that we can not just end of life, so that we can, you know, take care of them earlier on. And I think PACE is just one more model of that. But the biggest part about it is the health equity. I mean, we are helping. That's amazing what we're doing, how we're helping. You know.
Do you
So,
see yourself being able to expand the county territory?
at
I'm
this-
aware of 2 people that qualify all across the board, but they're not in the service area.
Okay, so are you familiar with Horizon Health? They're a large adult day provider. They cover 14 counties out of Richmond over to Bowling Green. They are also a PACE provider in 11 of those counties. They're up and running. Hospice Health, which is a huge provider similar to Bluegrass Care Navigators, it's kind of just west here. They cover a large part of Kentucky, and they're looking to get their survey readiness review in September to open their doors in January. And then there's someone else looking at Northern Kentucky, and from what I understand, every other county in the state has a letter of intent to pursue opening a PACE center. Now, whether that'll happen or how long it'll take, I have no idea. But we have definitely cut the trail. We have cut the trail for others to come, because when we opened, they didn't even have the bodies of knowledge they needed in Frankfurt to process the program. So now things are in place. So anybody coming behind us has got a much easier lift to getting their program off the ground.
Do you know if Horizon covers Pulaski County?
I don't know, Sarah, but I can let you know. I'm trying to think. I had it on.
The problem that the individuals in that county run into under the service care they're getting, and in this particular situation, I'm thinking of it is Medicaid. But they can't keep caregivers, they can't keep attendants, that, their hiring issues are an issue. And I know of an individual that went like 7 days with nobody checking in the bad winter. It's just, these are the disenfranchised that are lost in the cracks.
And that's the other big challenge for me as the coordinator, outreach coordinator. I can talk to a wonderful room full of people, like over at Ballard Griffith, my senior low-income apartments. The people that need PACE aren't coming down to hear me talk about it.
Yeah.
They're up behind the closed doors. So I very rarely get to really engage with an end user of the PACE services. That's why everyone needs to know about it, because you may know someone that can benefit. It's really hard for me to get that message to that person. I'll tell you what I'll do. I will send Susan the information on the Horizon PACE counties, because I got that.
Okay.
And what was the other question? Somebody else said something else that I didn't know. Anyway, I'll send them to her. Maybe she can put it in the newsletter.
Nighttime dialysis.
Nighttime dialysis. I'll find that out. Yeah. So,
Awesome program. Very
thank you.
perfect direction.
Thank you. I really appreciate your attention and your questions. It's been really an honor to be here with you today. I'm excited about that. Booked this several months ago, so here we are. It's great. And I have out there, and I have a different kind of brochure that's somewhat large print if you want to take one of those. My card is out there. There's a picture book of the PACE Center that has photographs of the different rooms. And then you're welcome to read a page or two of our enrollment guide. But thank you very much.
Thank you.
Thank you so much. This is Theresa. I have one more announcement, information to share. If anyone is interested in a diabetes fair, the health department is putting on a diabetes information fair this Saturday. It's from 10 a.m. until 1 p.m. and it's at the Fayette County Extension Office. Everyone is welcome. You don't have to live in Fayette County to attend. But Sam and I will be there with information on managing diabetes with low vision, and they will have health screenings, diabetes screenings. Excuse me. I have flyers regarding that. If you're interested and you want to take a flyer, just stop at the desk, the front desk where you checked in, stop up there and grab a flyer. And hopefully you can come out and join us. And I think they're going to have some giveaways and things like that too. So thank you all for coming today.
Thank you.
Okay, wonderful. So I just wanted to let you all know we will start our food distribution now. Judy, could you say something so that they know where to come to get their food, or we can bring it out to those of you who are signed up for food?
I'm over here,
Yeah,
over here, on the way out.
On the way out at the door.
so yeah, on the way out would be all
Be
right.
on the left.
But the wheels rides aren't coming until 2 o'clock. We can really work this out.
Well, what I was thinking was if they line up like behind me along this wall, they can come out, get their food and then go back to their chairs and wait for
Yes,
the ride.
come back to your chairs. Yes, so go ahead and if you signed up for the food distribution, we will be distributing that right now.
Just head towards this door and I will assist you with jumping in the line.
Where Theresa is.
And it's not a total line. But I'll help you jump in the
All right, well, thanks everybody for coming.
Right behind me.
We always meet on the fourth Wednesday, so.
Thank you.
It gets stated, and I believe that. Then she said,